In Walmart's Newville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Abercrombie Kids is bringing the cheer all holiday season, and the gifts too. No matter how long their wish list is, there's always room for just one more. Whether it's a new winter coat, an extra pair of jeans, or cozy matching sweat sets, get gifting with looks they've been waiting for all year. Shop Abercrombie Kids in the app, online, and in stores.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 oncology questions. Just a reminder that you can find these 3 questions as well as many more on our website at medprep2go.com. If you'd like to get involved with this project, please feel free to contact me at ted.medprep2go@gmail.com. If you like what we're doing, please let your friends know and consider giving us a review. And with that, let's get started with the first question. A 75-year-old woman with a history of tobacco use and type 2 diabetes is diagnosed with metastatic breast cancer, which is HER2 positive. She is eager to start the recommended therapy, but is worried about potential side effects. Her breast cancer oncologist wants to start neoadjuvant chemotherapy plus trastuzumab, or Herceptin. Which of the following side effects should she be concerned about, particularly from the trastuzumab? A. Hepatotoxicity. B. Cardiotoxicity. C. Nephrotoxicity. D. Neurotoxicity. E. Pulmonary toxicity. The correct answer is B. Cardiotoxicity. The patient has HER2 positive metastatic breast cancer, which requires neoadjuvant chemotherapy along with trastuzumab. HER2 plays an important role in the signaling network that drives cell proliferation. Trastuzumab, or Herceptin, is believed to block intracellular signaling pathways by attenuating the signal transduction downstream. One of its main side effects is cardiotoxicity. During treatment with trastuzumab, toxicity can cause the heart to become too weak to pump blood. All patients on trastuzumab undergo regular cardiac tests, such as an echocardiogram, to look for possible heart damage. The key learning point here: cardiotoxicity is a potential side effect from treatment with trastuzumab and requires monitoring. Question 2. A 24-year-old woman presents to her primary care physician with concern about a right breast lump, which she noticed 2 months ago. It is non-painful, and she denies constitutional symptoms. She has no chronic medical conditions except for generalized anxiety disorder, which is managed with escitalopram. Her family history is significant for colon cancer in her father at age 32 years. There's no family history of breast cancer, Lynch syndrome, or Lee-Fraumeni syndrome. Physical examination is significant for a discrete 1.5 centimeter breast mass in the right upper quadrant of her right breast. Which of the following is the next best step in management? A. Fine needle aspiration of the lesion. B. Initiation of tamoxifen. C. Mammography. D. Magnetic resonance imaging of the chest, or E. Ultrasonography of the lesion. The correct answer is E. Ultrasonography of the lesion. As this woman is below the age of 30 years, she is likely to have dense breast tissue for which other imaging modalities will be less effective, particularly mammography. Answer choice A, fine needle aspiration of the lesion, is incorrect. Although fine needle aspiration, or FNA, may eventually be needed to obtain a sample of the lesion, imaging is indicated prior to sample collection to better assess the lesion's features, for example, presence of microcalcifications, border definition, and composition. Answer choice B, initiation of tamoxifen, is incorrect. Tamoxifen is used to treat premenopausal women with estrogen receptor positive breast cancer. Although it is also used to decrease breast cancer risk in women at high risk, this patient does not have any high-risk features, such as early onset breast cancer in a first-degree relative. Answer choice C, mammography, is incorrect. In women under the age of 30, breast tissue is typically too dense to adequately visualize lesions with mammography. Answer choice D, magnetic resonance imaging of the chest, is incorrect. MRI may be appropriate to assess breast lesions for individuals with high risk of breast cancer. This patient has no family history of breast cancer and denies syndromes associated with breast cancer, such as Lynch syndrome or Lee-Fromini syndrome. The key learning point here: ultrasound is the preferred initial imaging modality for breast lesions in women under 30 years without high-risk features.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Question 3. A 65-year-old man presents to the emergency department with severe back pain and weakness in his legs. He reports that the pain started a few weeks ago and has progressively worsened. He also mentions difficulty urinating and numbness in his lower extremities. He has a history of prostate cancer that is currently being treated with Leuprolide. Vital signs are within normal limits. On physical examination, there is tenderness over the thoracic spine, decreased strength in the lower extremities, and hyperreflexia. Which of the following is the next best step in management? A, administer corticosteroids. B, initiate physical therapy. C, order a lumbar puncture. D, prescribe oral analgesics. Or E, schedule an outpatient MRI. The correct answer is A, administer corticosteroids. In the setting of suspected spinal cord compression due to metastatic cancer, the next best step in management is to administer corticosteroids. Corticosteroids help reduce inflammation and edema around the spinal cord, potentially preventing further neurologic deterioration while awaiting definitive treatment, such as surgery or radiation therapy. Answer choice B, initiate physical therapy, is incorrect. Physical therapy is not appropriate in the acute setting of suspected spinal cord compression and could potentially worsen the patient's condition. Answer choice C, order a lumbar puncture, is incorrect. A lumbar puncture is not indicated in this scenario and could be harmful if there is increased intracranial pressure or spinal cord compression. Answer choice D, prescribe oral analgesics, is incorrect. While analgesics may help with the pain, they do not address the underlying cause of spinal cord compression and are not the next best step in management. Answer choice E, schedule an outpatient MRI, is incorrect. An MRI is essential for diagnosing spinal cord compression, but it should be done urgently, not on an outpatient basis. Immediate administration of corticosteroids is the priority. The key learning point here: spinal cord compression due to metastatic cancer causes local spinal pain and neurologic symptoms such as weakness, sensory loss, paralysis, incontinence, urinary retention, and reflex changes. The next best step in management is to administer high-dose corticosteroids to reduce inflammation and prevent further neurologic damage, and order an urgent magnetic resonance imaging or MRI scan. Okay, so that's it for this episode, but please do check out our other episodes as well as our many questions that are available online.